we can get started since it is noon and everyone has, this is a lunch and learn, so we want to make sure that we get it done in our hour. I'm Renee Norden. I'm the Executive Director of the Mental Health Association, and I will be one of the presenters.
And I'm Bridget Downey. I'm the Programs and Events Manager.
So Bridget, if you can go to the next slide. One after that, please. And so the Mental Health Association has been in our community for 60 years. It's our 60th anniversary. But we have only been doing the Pride Survey. We've administered the Pride Survey 3 times here. This time, and it's usually every 3 or 4 years that we do it. This time we surveyed over 4,200 students, as you can see, 6th through 12th grade, both in Rappahannock County Public Schools, Fauquier County Public Schools, and also Highland School was the independent school that chose to also participate. As you can see, the distribution of those who took the class or took this survey. Next. Okay, so the survey went over and asked questions about substance use, mental health, and feelings of safety. And so we're first going to talk about the substance use. The Pride Survey, the Parent Research Institute Drug Education Survey, has been around. It's a national company that does these surveys, and they have been doing it for us since 1999. And so the first thing I'd like to talk about is the age of onset. And unfortunately, all 3 of these stats have decreased since our last survey before COVID. So this is the average age of onset for the use of prescription drugs. Now, these aren't prescription drugs that your doctor or their doctor would have prescribed for them. These are using prescription drugs, not for, a issue that you have. So that is 12.4 years old. Marijuana is 13 years old, and alcohol is 12.4. Understand that most students are not using, but we'll get into that in a second. What substances are they using? Alcohol continues to be the most common, though alcohol use is very down. 85% of students do not use alcohol. The greatest percentage of seniors to use alcohol actually was in 1983. It was in 1984 that Mothers Against Drunk Driving was successful in having the federal government link highway funds to the drinking ages. So that is why drinking ages went from 18 to 21 in 1984. And we have seen a decrease in alcohol use since that point, but it is still the most predominantly used out of all the substances. E-cigarettes, you can see pot is increasing. And as you can see, if you look at the percentiles, you see that most students are not using. The thing that is concerning that that came out in this survey was that for alcohol, marijuana, and e-cigarettes, female use is actually surpassing male use, which is not something, as I said, we've ever seen before. Okay. So this question asks our 6th through 12th graders, during the past 30 days, have you used e-cigarettes or alcohol? You can see again that alcohol is used more than e-cigarettes are. We are seeing a decrease in those e-cigarettes as well, but there is still use. Next. We were really interested with the legalization of marijuana. Well, this question would be answered. What we do know is our younger students feel that, we really need to educate well on the harmful effects of marijuana because of this new making it legal for adults. But as you can see, the use of marijuana and illicit drugs increases as the student moves through school. Next.
So we also looked at when and where youth are using substances, and we found that majority is at home or at a friend's house, and they're and so most of this is happening also right after school. So when we know these patterns, we can, implement other programs to kind of prevent this and get them funneled into other activities that would be more productive. So in all cases was higher when they're not in school. In a car was also pretty prevalent. And we think that, this is the time after school when they're unsupervised, the parents are still working. So it's of no surprise, but definitely more that can be done to get kids engaged in the after school time. And next screen. So current trends with vapes were primarily used in high schools. Tobacco is more prevalent in vapes with middle school youth, and alcohol is mostly happening at after-school events. And this was at the high school, and this was reported to us by Fauquier County Sheriff's Office. So it's a little bit about like what they're seeing that ties in also with the survey findings. So where they're getting their substances, we found mostly from a friend or family member, and that could be an older sibling, or it could be from, the medicine cabinet at home. Also a little bit concerning is tobacco stores, and we're working with, our community partners to address that. But, the purpose of this survey is to really see where we can, put more controls and more monitoring. So, your medicine cabinet at home should be definitely locked up. And then just keep an eye on, who is around, not only your child's friends, but their siblings as well. They can be a great influence. And so we also noticed a decrease in perception of risk by grade. So we know that when a student perceives something, or their friends perceive something as more dangerous, they're less likely to try it. But as they get older, that kind of perception perception of riskiness wears off. So the use goes up a little bit. And that's especially true with marijuana and alcohol. And if you have any questions when we're going through here, just, don't hesitate to speak up. We'll be happy to answer anything.
Okay. And so going back to the, Bridget mentioned that perception of risk. The thing that concerns us on that last slide is that our sixth graders perceive less harm, right, than our 12th graders do.
Yeah.
Usually our, experience teaches you that things are less risky. And so we want to make sure that we are talking to our younger children about the risks of these substances, not only, primarily in the household, but also at school. Next. And so this is the overdoses among Virginia residents here. So all Virginia residents, okay? But what really concerns us is, first off, if you look at that very light blue line, starts at the 40th percent or 40 per 100 emergency room visits. So these are drug overdoses that end up in the ER. We look at that over the 3-year period. We can say, thank goodness that it has started going down, but still that is 0 to 14-year-olds. Anyone have an idea of what might put our little ones in the ER for an overdose? You can put it in the chat, or you can unmute. Sandra, I saw you came back on the camera. Do you have an idea?
Maybe like getting into household medication that they shouldn't be getting into.
Exactly. And also like the THC gummies are the edibles now that adults can use, that are not now legal, not keeping those very locked up. They've had a number of young people end up in ERs because of that. They've even had a good portion of a second grade class end up needing to go to the ER because a young child, not here in Virginia, brought, CBD gummies to school. So we need to pay attention to what, if you are as an adult, you are choosing to use and have those substances in your household, or have prescription medication. Like Sandra suggested, we need to lock those up. The other concern is the age group that is ending up in the ER for drug overdoses the top age group is those 15 to 19-year-olds. It peaked at the beginning of 2023, but as you can see from Q3 to Q4 in 2023, it has started to increase again. So we look forward to getting the 2024 numbers. But that is the exact same reason we want to make sure that, access is a big part of this. We want to make sure as adults that we limit the amount of access. So I've done talks like this to parents at schools and things like that. And I always ask parents like, okay, because this drug overdose could mean alcohol overdose as well. But how many of you all have like a basement refrigerator or a garage refrigerator? How many beers do you have in there? Or what alcohol do you have in there? And a lot of people are like, oh yeah, we have, the beer left over from the picnic we had. I said, yeah, but how many are in there? I don't know. Number of years ago, we had Kevin Herron, who was a retired NBA player who actually had to leave the NBA due to his substance use. He has now been clean for for years and has started his own residential treatment facility. But his spiral into substance abuse started after school one day. He and his buddy got off the bus, had nothing to do. So they went into the garage and got 2 beers out of the garage and had their first alcohol behind the garage. We know that the earlier somebody starts using, the more likely it is for them to develop a substance use disorder. They start using at 13 or 14, there's a 70% likelihood that they will develop an issue. So the more we can prolong individuals, young people using, the better it is for them. If they start using at 21, I think it's only a 7% likelihood. That's right, that brain continues to grow until the age of 25. And we don't want that brain to get addicted or attached to those things. Here in our own area, this is emergency department visits for drug overdoses age 15 to 19. We don't have the Fauquier stats, but we do have the Culpeper ER stats. So in Virginia, you can see that over the last 3 years, it's remained pretty steady, slightly decreasing. In our Rappahannock Health District, which is the 5 counties, it is dramatically decreasing. But unfortunately, Culpeper started to dramatically reduce and now is pretty leveled off, but still high compared to the others. And so again, restricting use. I always encourage parents also to look in their medicine cabinets. Remove anything, remove all prescription drugs, lock them up somewhere else. Because you might, if you have children at home, or even if you're grandparents and have grandchildren that come through, understand they may not be the ones who are, taking some of your pills. But if they come with friends, those friends might be. So being able to protect your children, grandchildren, and their friends by locking those things up. Encompass Community Supports has locking med bags that are available for free if that's something you want to do. But we don't want to have it easily available. Next. All right, and so this is something the Fauquier County Sheriff's Office, these are their opioid overdoses. Of course, you can see that this is the county. That bullseye up in the center middle, that is Warrenton. Down there toward the southern end, the lowest bullseye, that is Bealton. And that area in between is more like the Kettle Run area, Brookside area. I'm not saying, oh, Kettle Run High School had opiate. No, that is not what I'm saying. But that is the area where that is happening. So for Fauquier County Sheriff's Office responding to overdoses, this is where we are seeing them in our community. And that is why they're paying special attention to those areas. Next. And so mental health and substance use go hand in hand. There are some researchers out there that believe that there is a mental health component to any substance use disorder. As you can see, these are the 5 most common of our mental health disorders or concerns. We saw large increase in eating disorders during the pandemic. Eating disorders can be centered around control. There might be aspects of an individual's life that seem they have no control. So by controlling what they put in their body, is how an eating disorder can form. But anxiety continues to be the most prevalent. As you can see, that's about 44% of our young people are experiencing anxiety. I really want to make sure that our young people are using terms correctly. A lot of young people say they're anxious when in all actuality they are stressed. Stressed has to do with an individual event, right? So you have a test coming up, you're stressed. You're going out on a first date, you're stressed. For an adult, maybe, family is coming over for Thanksgiving dinner and you're stressed. Anxiety is all pervasive and, it's like nothing is going to go well. And so making sure that, if a young person were to say to you, I'm anxious, ask them about that. What are you anxious about? And if it is about a test or a project that's due, say, oh, you're stressed, just so we can make sure they're using the right language. When I was going through high school, depression was the most diagnosed disorder. Now, as you can see, anxiety is far above that. And you can also have co-occurrences. So a lot of times individuals who are anxious are also depressed. Self-injury, that would be non-suicidal self-injury. That typically people refer to that or, think about cutting, right? But it is self-injury without intent to, to die or to kill oneself. That could also be excessive risk-taking, gambling, excessive exercise, and things like that. And then substance use is the smallest of those concerns. Depression remains pretty constant. It rises slightly, or a little more than slightly. Again, that's less than 35% of the student population. And to get an idea of what the question was, the question asked our 6th through 12th graders, had they felt sad, down, or hopeless for 2 or more weeks in the last year? Because that is the diagnostic requirement to be diagnosed with depression. It has to be 2 or more weeks. Next. Anxiety, as you can see, is higher in our 6th and 7th graders. We think that one of the reasons it might heighten a little in 9th grade is due to that transition from middle school to high school. But again, it is impacting a great number of our young people. Everything that, we've talked about is a concern to me, but this is one of the ones that really saddens me. That during the past 12 months, 26% of our respondents wished they were dead. Suicide is the second leading cause of death for young people. It is a permanent solution to a temporary problem, and we really need to do as much as we can to decrease this. And so what leads to these feelings of I wish they were dead? Schoolwork is what our respondents said stressed them out the most. Okay, then family, extracurricular, and friends. That really hasn't changed that much. And how do we handle stress? Most said sleeping. As mental health professionals, we know that if you aren't getting enough sleep, that's a very good thing to do, sleep. But if you're sleeping more than you need to, it actually is a way of withdrawing and not like getting into a better frame of mind. Talking to someone is a very powerful thing. It concerns us, and we're going to get more into this about what our young people, what percentage of our young people feel they have somebody they can talk to. We like to get individuals who are having difficulty doing exercise because we know it increases the endorphins in our body. Also getting outside, getting in the sunshine, things like that. And then they also said eat, shopping, and gambling. That can become more problematic, of course. and less than 10% wanted to have some sort of self-harm or violent behavior.
So I can take it.
Perfect. Okay.
So we also asked, who, if you're dealing with sadness or depression, who would you talk to? And majority said their friend, which is a great thing. We're glad that students feel comfortable now. I think the stigma has definitely decreased, and they feel comfortable talking to their friends about their concerns. And a good majority, well, actually, it looks like more said parents or another relative, and we're also happy about that. But we also want to make sure that the people they are turning to are trained to, know when to intervene and when it can be a crisis. So that's why we're really pushing mental health first aid. We have that offered every month. So if you're interested, just look at our website and see when the class is offered. And there's a variety of other adults or, peers that they can turn to. And we always want to encourage them to find someone that they think that is affirming for them. If you can't talk to your parent, maybe you can talk to your best friend's parent. And we always want to encourage those other people that they can reach out to so that they have a very strong support network. Maybe their parent's not available or their friend is, busy with sports. There's a world of other people that can help them. And we just want to make sure that everybody, knows the right approach and things to say. And that friends, when the peers, when students do reach out to their peers, it's not too much of a burden for them. It doesn't also stress them out. So they're not just one circle, just all stressed out, talking to each other. We want to make sure as adults that we are staying involved and engaged and knowing what's going on. So this was a good look at, what are the obstacles to seeking help? Most said I can handle it, and while that's encouraging, we're glad that they feel that they have that support within them. We also want to encourage other avenues that they can and people they can reach out to. A lot said I don't know where to go. Family would not support. Transportation and paying for it were not as big as concerns as we thought they would be. So that's encouraging. And then you can see we still have a fair bit of stigma to address and to deal with as a community, with a lot of respondents saying they're worried what others might think. But I can say that that has decreased a lot in the past several years, so we're happy about that. So protective factors are those things that youth can do to ward off symptoms of depression and then, getting involved in substance use and other dangerous lifestyle activities. So, and this question just looks at, what percentage of students do participate in these protective factors. So it takes part in community activities, takes part in school activities or sports teams. What we are concerned about here is that this has greatly decreased. I think it started decreasing before the pandemic and now has definitely decreased to kind of a concerning level. We don't know if that's because, just habits from the pandemic that they're just self-isolating, or if it's just reliance on technology. They love just being at home, being on social media, playing games. But we do know that being connected and participating in community activities is going to be a protective factor and a counter some of these concerns. So we do want, as a community, we do want to do more. And as parents, we want to encourage our children more to be involved. So key overall findings, we're very happy that substance use is down. And I have to say nationally, it's very encouraging that our prevention efforts are working. It's gone way down. It continues to go down over the years, but we are concerned about those small percentage that are using, and that substance use for those that are using is happening at earlier ages, because that's, as Renee said earlier, that's an indication there are going to be more serious concerns later on in their life. We're happy that 85% of students do not use alcohol compared to 76% in 2019. 95% do not use marijuana compared to 88% in 2019. Still, as we talked about earlier, marijuana is becoming something that's more considered acceptable because for adults it's considered more acceptable. So we do want to watch that. We want to watch our language and how we talk about substances, and definitely not give the impression that it's accepted for youth or for many adults as well. It cannot be a positive thing. 93% do not use e-cigarettes, which is an increase of 12% since 2019. And we're happy that youth are turning to friends and parents for help. And then this is just a summary of some of the things that we talked about earlier. Key points that we want, everybody that hears about this survey to know. Most use is occurring in their homes or at their friend's house. We think older siblings are a big influence. Less students are participating in sports and extracurriculars. We want to make sure that there's plenty of opportunities for that to happen after school, and that there's plenty of people for them to engage with. Students' perception about e-cigarettes and marijuana is changing, like I said before. Female substance use is surpassing males, and after school is a risk time After school is a risk time period for student substance use. And some students feel they have no one to turn to for help.
Victoria, Victoria, do you have a question?
Sorry, no, hit the wrong thing.
Okay. Sorry, Bridget. Thought we had a question.
All right. Everyone feel free to, ask a question at any point. So it is very encouraging that students are turning to others, turning to friends, turning to parents when they want help, but there's still that percentage of students that don't feel they have anyone. So we all want to be that adult that's youth can turn to. We all want to take part in this community and keep an eye out and be there for somebody when needed. And from here, I will let Renee.
Okay. And so, as we've talked about our concerns, I mentioned this briefly, but we know that substance use is a pediatric onset disease, right? So 90% of adults with substance use disorder began drinking or smoking before the age of 18. We know that. So anything we can do to remove the access to substances is a great thing. So if you are an adult who smokes cigarettes or uses vape pens, lock them up. If you are an adult who chooses to drink, make sure that your liquor cabinet is locked. It just removes the temptation, right? When our young people get bored, they look for easy sort of risk. And if it's easy to get alcohol, nicotine, marijuana even, then they might try it. Also, as Bridget said, older siblings. If you were in a home that maybe your oldest has already started experimenting and you caught them with it, make sure you hold them accountable. Make sure it becomes a family conversation, not a family secret. So if you catch your 18-year-old with pot, yes, have there be consequences, but also have the younger siblings know that he had pot, that's not acceptable. A number of our students anecdotally are telling us that their parents never mention things about drugs or just say things like, don't do it. There is a organization called One Choice Prevention, and they are recommending that for our youth that we don't talk about the legal reason not to use or the moral reason not to use. But this generation is responding better to the health reasons. The earlier they start, the more likely they are to develop a substance use disorder. We know that the brain, when it's in its developmental stage, is primed for that. We know that individuals that use, it impacts their ability to live, laugh, love, and learn. And so I did upload our 2024 Pride Guide into the chat. It does list One Choice Prevention's website if you'd like to learn more about their efforts. We also know that all drug use is interrelated. Individuals who use alcohol are more likely to use pot. Individuals who use pot or alcohol are more likely to experiment with other substances. I know there's been a big argument about whether or not pot is a gateway drug. It is not a gateway drug in that says that, well, if you use pot X number of times, then you're going to use something else. What happens is when you're under the influence of pot or alcohol and you're using with others, there are others probably in that group that are using other substances. And when you are under the influence, your inhibitions are down and you are more likely to try something that you wouldn't try otherwise. And so that is why it is all related. Okay. And that we know, we already talked about this. The brain is developing. It has a greater impact, right? The thing we haven't talked about is also that I wanted to bring up is cell phone use, right? We know that individuals, our young people, are addicted, right? People try to remove the phone from them and you will see signs of aggression. You will see signs that look like other withdrawal because these were designed to be addictive. I know that Fauquier County Public Schools on September 19th is going to be live streaming the First Lady of Virginia's fireside chat with the author of The Anxious Generation. Fascinating book. Probably also, but great book, but they will be doing a fireside chat. And then Rappahannock County Schools is also doing it. In Rappahannock, the high school principal will then lead a discussion after the fireside chat about what Rappahannock is doing and how parents can partner with them to help regain our young people's attention. And Fauquier County Schools are doing the same thing. This fireside chat will be recorded. So I know Highland School is going to be doing it also in November for one of their evening events. But not only do we need to worry about these for our young people, but also for ourselves. We know our youngest ones have been impacted. Our little ones are having trouble with emotion identification. We think that is because their parents' phones are in their faces so much, they don't have the interaction that they used to with their parents. We know that these are by parents are being used as ways of calming children down. We need to stop that and allow children to figure out how to calm themselves down. But there's lots of new research coming out about this. And so I hope people will find a way of seeing the First Lady's fireside chat because I think it will be impactful. Any questions? Bridget and I can talk about these stats forever. I know Brandy, who was also on the call, was also part of this committee, and so did Christine. So questions, observations, what do you all think about what you've heard?
I'm not like surprised really about it in a way, because I work with kids over here at Encompass anyway, so there is a lot that we are, hearing in homes that have like teens, like between 13, 15, 17. And the phone is very addicted to them, We try to connect with our families and be like, okay, let's find coping skills. What does that look like without the electronics?
Right.
How can we communicate? Because our children are shutting down and they're not communicating. And then they're turning to either the phone or something in the house, alcohol, medication, something that they can get their hands on. And unfortunately, sometimes our families are just so busy working. Both of them are trying to work to survive that the children are getting into things. So I think like the percentage, is accurate. It just caught me by surprise that it's that high. With the females, especially the females, making those choices more than the males. But I think it just lets us know like where the work has to be done right now.
And, I think that's a great point, like where the work needs to be done. If any of you all, a lot of you have already heard me be on this connection bandwagon. Surgeon General has said we are a lonely nation. Being lonely is the equivalent of smoking 15 cigarettes a day. But if we are lonely, we don't have those connections. We don't have people to support us. And so we develop these disorders and seek substances for comfort. Okay. Anne, you had a question?
Yeah, it seems like the problem has been described very well. I'm just not sure where the solutions lie. What kinds of things can the schools do? What kinds of things can the general public do? I mean, I don't have any kids in school, but I consider this a huge issue. How do I do something about it?
And I'm so glad you asked, because in there our printed Pride report, we put recommendations on the back for community, for home, school, and community. Some of the things that we suggest are, you know, make it a priority to nurture your relationship with your child. I know, as Sandra was saying, you know, we're so busy with work and everything, but the priority has got to be the relationship if we're going to prevent later problems down the road. And that can be with your grandchild, you know, any youth life. It's really important. We also need to discuss substance use more often. We need to discuss the dangers and give accurate facts about the risks. Not just and like Renee said, focus on the health effects. And then for ourselves, we need to model healthy behaviors. You know, watching our own cell phone use, watching our own, you know, if we go out every weekend and in order to have a good time, we give the impression that we have to have 2 glasses of wine or more, that's going to model unhealthy behavior and give our young ones the impression that that's what it takes to have a good time. So definitely, you know, go out, have fun, and have fun that doesn't involve substances. And then pay attention to the language that you use. You know, calling somebody, you know, this is kind of a different topic, but it just addresses like the stigma, calling someone addict, you know, saying disparaging things is not going to be productive to the conversation or these concerns in the community. And then, as Renee said also earlier, you know, if something happens, you know, or even before something happens, definitely establish expectations, set boundaries, and follow through with consequences, and then make explicit rules about your expectations of drug and alcohol use and the reasons that, you know, that you care for them and that you don't want them to, you know, go down the wrong path in life.
But Anne, I think also, you know, that modeling of language and actually asking young people questions. Like, I think it's fascinating now to have conversations about screen time. Recent report in Virginia said the average student spends 3 or more hours on their screen. And that doesn't include school time, you know, school studies, school homework, 3.5 hours. Another study came out that said high schoolers spend 95% of their time connected, their time awake, connected. And so I'm really excited that, you know, the governor has sort of issued this challenge to schools on removing phones from the classrooms. I laugh because I was talking to one of the SROs and she was saying that her high school, which is one of the Fauquier high schools, was saying it's like going to school in North Korea now. And of course, I have no idea how they think it's like school is in North Korea, but apparently if you restrict cell phone use, it's like being in North Korea. But we know from other schools who have done it, who have done much more restrictive ones, that there's a growth period. And so our young people's brains there's neuroplasticity, which allows the brain to reform, you know, repattern. We know from tests with these phones that screen time changes the structure of the brain, but removing screen time, the brain sort of heals itself. And so we're hoping one of the schools I read the report on was a middle school who restricted cell phone use all day. You didn't get it at break time. You didn't get it at lunchtime. And if you had an emergency, you could go to the front office and they would help you. But they said within 2 to 4 weeks, the lunchroom became this happy, you know, kids were bringing in board games and card games and people were talking and interacting and creating those connections. So we're hoping that with this new focus on cell phones, we're moving in a right direction. And then anything we can do to impact the loneliness of others. So it isn't just our young people, even though we're talking about young people now. It can be parents. In fact, I was joking with Christine and Bridget that I wished the Surgeon General would just slow down because, you know, he first came out with the youth mental health epidemic. And then he came out with the social isolation epidemic. And here at the Mental Health Association, we're trying to impact those. Well, recently he came out with the, you know, our parents are overwhelmed. And I'm like, okay, we need to just concentrate on one of these to help heal the rest of them. But yes, the parents are feeling overwhelmed. So, you know, if you don't have your own children, maybe you have children and you have grandchildren, giving your own children like time off. Go say, hey, I'm going to spend the day with the grandkids or even a neighbor. You know, it's funny. I'm developing a relationship with a 4-year-old who lives next to me because my children are in their early 20s and I don't want them to be parents yet. But I still want that interaction with a little kid. I want to be able to watch Disney with her so that people don't think I'm weird watching Disney by myself. But anything we can do to connect with our community will, with the ripple effect, help what we've been talking about today. Other questions? Has anyone heard of any other programs that you think would be interesting for us to hear about that have, you know, lessened substance use or lessened mental health concerns?
I think it's just really hard with substance abuse, like use with our minors. Because we got programs, but our programs are for 18 and up. Sometimes we might be able to fit our 17-year-old in SAMHSA, you know, virtual groups, or, you know, they have a hotline they can call and say they're feeling, you know, triggered right now, or they're feeling a certain way, and they can, you know, talk them through it. But when we're talking about 13, 14 years old, 15-year-olds, we really just need more programs to focus on the youth that are struggling in ways, you know. I mean, the best we can all do is try to work together as a community and either support the parents, encourage them to talk with their kids like you guys are doing. You know, this is the problems and this is the solution. Let's, you know, work together to try to help. But I am waiting for a program for these teenagers that I can refer out to when I have these kiddos.
Mm-hmm. I think that's great. I know that the state of Virginia is in a pilot program right now. So some of you might not be aware, but the quickest growing mental health professional out there now is a peer support specialist. And peers are individuals who have their own lived experience in mental health, substance use, or both, or have had a family member who have had experience with mental health, substance use, or both. And so fabulous. We're finding that individuals who are struggling are much more likely to connect with somebody who has lived experience or who has, you know, family members with lived experience, and that those that connect with a peer are more likely to seek help with a counselor or a psychiatrist and things like that. Well, in the state of Virginia right now, they're doing a pilot for a youth peer support specialist. Now, that is not young people supporting young people. It is like 18, 19, 20-year-olds who are going through special training so that they can be that peer support for those young ones. I know that Northumberland County was one of the pilot sites, so it's going to be interesting to see what's coming out of there, if that's a program we can expand to the rest of the state. Other programs or other solutions you think might be out there? Yes, Elaine.
Just one more suggestion, and that's in terms of, if possible, in your community, school district, showing up at school board meetings, especially when there's an issue pertinent to mental health issues and programs that might be considered in the budget or might be considered in terms of, well, whether as a school board, as a district, do we want to initiate specific programs. There have been a few programs discussed within the past 2 years. One of them specifically was Second Step. And several community members showed up and talked about the importance of these types of programs that help children manage mental health concerns, issues, problems. And so I just think that's a really important piece in terms of lobbying as parents, community members, mental health professionals, showing up and expressing our views of how important these types of programs are. The school board needs to hear that, and they need to hear that from all of their constituents. Thanks.
Lane, I think that's a great idea. And I've seen you stand up before at meetings, so thank you. But also, you know, if maybe standing up in front of a room full of people is not something that you feel comfortable with, calling your individual school board member and talking with them or meeting them for coffee is a way to start on this journey of becoming an advocate for these things, because we need to let people know that it's important. I think especially in, you know, it's been very divisive recently, and sort of separating out, you know, what our kids really need from all this political division is a great thing. Any other suggestions or concerns? The thing we didn't talk about, that if you do download, because it is in the chat, it's also on our website if for some reason it won't download. We also in here talk about feelings of safety, and the vast majority of our students feel safe in school. And so I think looking at where they aren't feeling safe, the bathroom is always the biggest one. I know schools are really trying to figure out ways of, I'll say, policing that area. But at the same time, think of yourself as a school teacher who's already overwhelmed, and all of a sudden you get to monitor the bathrooms. And so anything we can do to help the school. We are looking at a number of different programs. And so right now you all need to be aware, like in Fauquier County, all 10th graders in their health and driver's ed class go through teen mental health first aid, which is a nationally recognized program that shows them, you know, how to recognize signs of pattern changes and then go to a trusted adult. So it's a great program. Rappahannock County schools are now also working with Notice Talk Act, and say they do youth mental health first aid training for all their teachers. But with Notice Talk Act, they now are going to be also educating their food staff, their bus drivers, any other staff that hasn't gone through that youth mental health first aid training. I'm excited about the bus drivers, because the bus drivers get to see a little snapshot into that family every morning and every afternoon. And they can notice the changes quicker, I believe, than the rest of us. So there is efforts here. We know that the Mental Health Association is also bringing together a youth dialogue. And so we'll have teams from each of the high schools in both counties and from middle school and some middle schools in November, getting them together, sharing what we've shared today, and listening for student voice on how to impact these issues. What do they see as ways of addressing these issues? So we're excited about that. Anything else? Yes, Anne.
One more question.
Mm-hmm.
What is the effect of bullying on mental health and some of these problems? And are schools doing enough about that particular problem?
They are trying. And yes, bullying can have an effect. And of course, people are always saying, well, it's also, the bully is also, you know, impacted. Yes, because bullies just don't naturally exist. But they are grown as well. So if we can, you know, through connection, through recognition, not only help those that are being bullied, but the bullies themselves. It's a way of interrupting that cycle. But it really is hard because having individuals, bullies are smart. It isn't like they are going to like stand in front of the classroom and bully a person because, and so having more people being willing to say, see something, say something, just like adults, and when you ask, how can we help? Adults being observant, saying, this is what I noticed. Maybe, your neighborhood bus stop is right in front of your house. And you notice that this individual seems to be picking on people. I'm always in favor of calling like the elementary school counselor and saying, hey, I don't know these children's names. This is where I live, but this girl and describe her seems to be picking on the younger kids and it's bus number, whatever. Allow them to help. If you are maybe waiting at the traffic light next to Walgreens and you look over at the tobacco and vape shop and you notice there's some young kids hanging around on the side and they've given money to an older kid, feel free to call the non-emergency, Warrenton Town Police telephone number and say, hey, this is just what I witnessed. I will tell you, town police think that is the best thing ever. To just pull up and be able to address what's happening. So the people who aren't like reaching out, if you see something, maybe you are on Facebook and see something that worries you. It is fine. I mean, the Warrenton Town Police, the sheriff's office are happy to do well visits. And it just doesn't have to be for our own community. I was telling one of the adult mental health first aid classes I was teaching. Years ago, I was working at an independent school and somehow I am still friends with a young man. I had always told my students I couldn't be friends with them until they graduated. And so on graduation day, I would get some requests for friends and I'd just say, yes, yes, yes. Well, I hadn't seen this young man for maybe 20 years, 25 years. And I had noticed that his posts were getting darker and darker. And so I took some screenshots. Yes, there are some good things that happened with this phone. And I called the non-emergency number in Clearwater, Florida. And I described who I was. I told them the name of this person. And I said, and I have screenshots. And she said, please send them to us. He was off of Facebook for about a month. And after that, he came back and he said, thank you, everyone, for your concern. I am better. And I'm getting the help I need. So know that you can do big things without being a big presence in it. Allow the professionals. If you can hold somebody's hand to their first mental health appointment, or maybe to going to the ER. Now, I'll tell you all here that if you need to go to the ER for a mental health concern, go to Prince William Hospital, or Fairfax Hospital, or Culpeper Hospital. They all have access to mental health treatment, and they have their own treatment, so it's easier to get into those treatments. If you go to Fauquier Hospital, unfortunately, they don't have mental health treatment in their hospital, so they have to find other places to send you. And so individuals can wait long days in the ER waiting for beds. So make sure that you go to the hospitals that actually can provide direct service. Other questions?
I just want to add and emphasize the importance of emotional regulation is a lot what this comes down to. And, teaching your youth or anyone in your life how to better regulate their emotions can eliminate a lot of problems. Some program that we tried recently, which may not be, for everybody. What was the auditory?
Safe and sound protocol.
Sound, yeah. So you can probably explain it better than I can, but it's one approach. I'm sure there's many, but if you want to tell them more, Renee.
Sure. The safe and sound protocol, the way we calm our central nervous system, right? Vagus nerve runs right next to our middle ear. And so there is now and so that's why they tell you to sing or chant or whatever to stimulate the nerve and it will bring that emotion down. But the Safe and Sound protocol has been around for over 20 years. Jane Probst, one of our local counselors, is currently part of a research study on it so that it can be an evidence-based program. But it is wild to me, and it makes sense not to be the whole problem, but to be part of the problem. And so it is a listening protocol. You are listening to music, and it is tuning and toning your middle ear. Research has shown that if the muscle underneath or in your middle ear is too firm, isn't pliant or pliable, I guess I should say it, those individuals are more likely to have problems with emotional regulation. It's fascinating to me. And so I, of course, being the kid who never reads the directions, just moves forward, I was doing it because before I can recommend anything, I need to try it. And so Jane gave me access before she told me what I was supposed to be doing with it. And so I just picked my little tract, and it was Disney music, and I am singing with the Disney music as I'm laying there, because you only listen 5 minutes to 15 minutes. It's an amazing thing. Well, anyway, I was talking to Jane later, and she goes, "No, you can't sing." And I was like, "No, I can sing." And she goes, "No. That defeats the purpose. Because if you're singing, your middle ear doesn't have to work as hard because your bones are also resonating the sound." And so what's fascinating to me is that you have to wear headphones to do this protocol, and they can't be noise canceling. Because if they're noise canceling, again, it isn't making that middle ear work. And if you can't wear earbuds, because the earbuds are also playing off your bones. Think about how many of our young people use earbuds. Think about how many adults use earbuds. And so if this was a way, and so anyway, if anyone is interested in becoming involved in the study, Jane and her colleagues have a year to get as many people through the protocol as possible for free. So Elaine, I know you're a counseling person, so if you wanted to try it yourself to see how it would work. To me, it's fascinating because it is just listening. There is no talk therapy part of it. I found for myself, I am not typically an anxious person at all. For me, it made my hearing almost too sensitive. So now, like when I'm out on my walk, when the big trucks go by, it's almost irritating to me. But I know of numerous cases where it has changed their lives. And it's especially good for people who are wary of talk therapy. It allows them to kind of try this to see if it works. And I think it makes them more open than to talk about it later. But I think, Bridget, can you also put Jane's email address in there?
Sure.
So if you want to read the big articles about it, Bridget has added that to the chat.
And we also have on YouTube in our library, we have a Lunch and Learn with Jane that talks more about it if you're interested.
Yes, and she explains it a whole lot better than I do. She even has diagrams that shows you why it works.
Hey, that's just one interesting approach. Anything that helps anyone in our community learn how to better regulate their emotions, I think is helpful. And a lot of that comes down to those protective factors, such as being involved, being connected with people, singing, doing something creative. Those are all helpful ways to release, negative emotions, negative energy, and get back to a sense of stability and regulation.
That's great. And one other thing, I like to call it sneaky mental health. If you have young ones or older ones that are having some concerns, finding books that have characters in them that are not the primary reason for the book is this concern. But I can't remember the name of the book, but in one of the books, one of the characters had concerns with anxiety. And at the beginning of the book, anxiety would just take her away from experiencing it. But by the end of the book, she was using positive coping strategies, it was like a murder kind of mystery teenage kind of book. But sneakily, there was this like young person experiencing challenges. And young, little kid books are fabulous for identifying emotion and showing how people can handle emotion and things like that. We did a project with the Rappahannock County Schools and with Fauquier County Schools, and actually gave positive mental health books to the libraries so that they're there. But I know the Open Book has done programs with us as well. So bibliotherapy also is a wonderful way of helping impact this. Any last questions or concerns? Because I know it's 1 o'clock. Yes, Anne.
Just one last thing. I don't want to get into a political discussion on this, but one of the problems we're having in the school system is people who want to remove books because they find them objectionable. And they find them objectionable for the very reasons you just gave for why kids should be reading them, because they see characters who have problems that they have and how those characters resolve their problems.
Mm-hmm.
And if we remove all those books, we can't follow that plan.
I had a student once that read every banned book. She wanted to be a rebel in that way. So
good for her.
Sometimes labeling them as banned book also inspires kids to find ways of finding them.
Yep. We also were able to donate a lot of those books to the public library too.
That's right. Okay. All right. Well, thank you so much for joining us. Bridget, you want to talk about the topic of our next Lunch and Learn next month?
Sure. We're going to be joined by members of the Veterans Task Force to talk about their programs and resources with a special focus on female veterans who are dealing with PTSD. So definitely tune in to that. Our webinars are always the second Thursday of the month at noon. And we encourage everyone to attend and ask questions and just learn and engage.
Thank you, ladies.
Thank you.
So, have a great afternoon, everyone.
Thank you, guys.
Very much.
Take care.
Bye.